she used that.
Okay.
We had,
Yeah, you ate it
we
all.
had turkey pie. Just when we were like, but we
Thank you, thank you.
again,
So we'll get started here. I'm Bob Dellavalle, the director of the Cochrane, Colorado U.S. affiliate, and I want to welcome you to an update on our activities, and welcome Mindy out there in internet land. Thank you for joining us too. So I have to declare that I'm a Cochrane Skin Group Joint Coordinating Editor, so I'm involved with Cochrane Skin Group Systematic Review Production. And the major, well, the initial title of this talk was going to be Updates from the Cochrane Colloquium, but there were riots in Santiago, Chile, which caused the cancellation of the colloquium there. The in-person meeting has been canceled. Here are some of the pictures from the gatherings down there to protest inequality in the economic system of Chile. And the triggering event was a 4-cent increase in the subway tickets. It led to a lot of destruction of the subway system and some buses as well. And because of the arson and riots that really peaked right on the day that the Cochrane Colloquium was going to start, the organizers decided they had to cancel for the safety of all of the participants. And they said, whoever's not here, please do not come. So luckily I was not there yet. I wasn't on the plane, so I didn't get on the plane and stayed home and monitored the situation remotely. Military rule was declared and curfews so that you couldn't be out after different times in the evening. One night was 6 p.m., another was 8 p.m., depending on the night. And essentially, because of the riots and the strikes, they were not able to prepare the venue. So the venue was not ready to go. So there was no choice in the matter. They had no venue. They had all of these curfews to deal with. So, nobody could be out on the street. So there was really no choice in the matter of canceling the event.
Some of the people had already arrived.
Yes, some of the people were on airplanes going there when it was canceled. And had they canceled, 5 or 6 hours later, I would have been among that group. So some people flew to Chile for the weekend and flew back because nobody really wanted to be there with the martial law. It was really a big imposition on anybody who had an Airbnb as opposed to a hotel. If you were in a hotel, at least you could get food from your room service. But if you were an Airbnb and there was no food there, all of the shops were closed for a number of days. So people coming from other areas who had done maybe a vacation in some other part of the country were told, if you come, bring food. So people brought salami and cheese and bread from other areas of Chile. And the riots did spread to other areas of Chile too. So it was not just isolated to Santiago. So because of the cancellation of the colloquium, the first time in its 25-year history, they're going to try, the Cochrane's going to try a virtual colloquium this year. So all of the speakers and presenters, they're trying to have them present over the December 2nd to 6th time frame. So I encourage you to check out what you can with the colloquium. There's no registration fee for participating digitally. And there's the hashtag and there's the website. So the oral speakers will be speaking, the posters will be on Twitter, and they're going to see exactly how much of the colloquium can be done digitally, which is a major issue if climate change is going to be impacting face-to-face international meetings in the future. Considering how much of the face-to-face interaction can be substituted for via virtual interactions is a major research issue. So the Cochrane's tackling this head on. Now, the Cochrane Colloquium wasn't the only meeting in Santiago to be canceled. There were 2 other major international meetings, one of which was going to have President Trump attending. So we were one of the 3 major meetings that were canceled there. So each day of the virtual meeting will have a different theme. Equity Matters is the theme of Monday, December 2nd. Stakeholder Diversity is the theme for Tuesday, the 3rd of December. Methodological Diversity is the theme for Wednesday, the 4th. Looking Back is the theme for Thursday, the 5th. And Looking Ahead is the theme for Friday, the 6th. So the virtual meeting is not the only meeting that will be happening in December. There will also be a meeting of all of the U.S. Cochrane Network affiliates and associate centers. So there are about 21 of these in the U.S. and 15 of them will be represented at this face-to-face meeting in Philadelphia, including ours. I will be going to this meeting. And there will be no virtual telecommunication for those who aren't there. So you're either in Philadelphia or you're not for this meeting. And if anybody else wants to go, please let me know, and I can try to get you into the meeting to help represent our Colorado affiliate. Unfortunately, we don't have any money to support travel. But in case you want to go to Philadelphia anyway, or going to be there for some other reason, here's your opportunity to be a part of this network meeting. It's going to be a 1.5 day of internal meetings, and then it's going to be opened up to public stakeholders for the afternoon of the 11th. And already there are stakeholders from the Robert Wood Johnson Foundation, from the CDC, from the EPA. So there's been a lot of interest, and a number of private foundations who fund medical research or are interested in attending and will be attending. So it's a very exciting development. Yes, Lisa?
I was just going to ask, do you know if there's a group of librarians that plan to attend?
I am not aware of any librarians currently attending. Do you know of any in Philadelphia who might be interested?
Well, I don't know, and it makes me wonder if, my assumption is you have an email group for the network members.
It's coordinated by Fonda Ripley.
Okay.
So I would suggest emailing Fonda Ripley if, like putting her in touch with any librarian who might be interested in attending. If you know of a Philadelphia librarian.
So we can create a U.S. network of Cochrane librarians. Because it would be useful to go, I mean, it'd be useful to hear about it, but to meet, I'm not thinking of meeting it. You all that do the systematic reviews to go meet with the other librarians engaged in the network. And
I just don't know if any librarians are attending from other networks right now, but we can certainly query Fonda and find out. Yeah. Put you in touch. I'm sure every center has some librarians who are working with them. I just don't know who's going to the meeting.
Well, especially in Philly, it'd be easy enough for people on the east, in that corridor to get there for a day, even if they don't stay.
Mm-hmm. Yeah, great idea. So we'll get in touch with, that'll be an action item for us. Okay. Get in touch with Fonda about that.
Well, and Tianjin actually connected me to Lori Rossman, who's the Eisenvision librarian, or was, I guess, since I came here.
Okay.
And so I can get more information.
Yeah, I'm not sure if Tianjin will be going to the meeting or not.
Okay.
Yeah, she's recently recruited Cochrane systematic review methodologists who will be on our speakers list in upcoming months, and great to have her on campus. She was located at Johns Hopkins before she came here and was at the U.S. Cochrane Center with Kay Dickerson. So she's very, very knowledgeable about all things Cochrane. And we're very fortunate to have her here with us now. So in addition to the face-to-face meeting, there have been regular conference calls with subcommittees of the network affiliates. So I'm just going to review those for everybody in case you have an interest in one of the topics that people are meeting on already. And you might consider creating another group for librarians if there are hot issues for that. So there is a meeting of the Cochrane networks, and I just got off the phone with that. That happens every month, and representatives like myself talk about things. And this month we talked about, for example, advocacy of Cochrane at our respective networks, and we also talked a lot about the upcoming meeting, and we talked about all of these updates that I'll be giving you on these subgroups as well. An interesting aspect of advocacy that I mentioned is our current lecture series to advocate on our campus. And MD Anderson has a similar lecture series, but not a lot of other networks piped up that they have it. So it's an area for different networks to consider creating lecture series. There are, of course, training events at different networks. And there are some work with guidelines development among American professional medical societies. I know I work with the American Academy of Dermatology, and we've spent a number of years getting them to switch from a previous system of grading evidence to grade, the system that's advocated the most by Cochrane and the methodologists in Cochrane. And that's been a 6-year journey for us. So we'd be happy to tell other people involved with other medical societies like Tanjing, for example, who's involved with the American Ophthalmology Association, help her to advocate for Cochrane with that medical association, advocate for the grade system of working on guidelines development, and have people who are going to Cochrane meetings and getting Cochrane training, helping with guideline development in these different medical societies. So I'm thinking I would like to create a spreadsheet of all the American professional medical societies, see who's using grade, see who's supporting Cochrane and sending people to Cochrane meetings, and sort of make a national initiative out of this for our network. That's where I'm thinking there. And that just came to me on the call this previous hour. So. One thing that hasn't been sorted out yet is exactly how the network will govern itself, who will be the leaders among the 21 different network affiliates. It can't be 21 people, that's too many people. So we have to have some kind of executive leadership. And it's probably going to be a 501c, whatever that acronym is for a nonprofit foundation. We have to get that set up in order to facilitate funding. So those issues are being dealt with an attorney on those governance calls. And the next governance call is happening the 21st, which I think is tomorrow at 10 a.m. So if somebody's very interested in joining me on that call. There's also a strategy meeting for the network, defining what our strategy should be with regard to advocacy, systematic review, production, and cooperation among each other. And I wasn't able to pull up the next call, but I know there is one scheduled. And obviously strategy and governance will be spoken about a lot at the upcoming meeting in Philadelphia. There's also a group of consumers involved with consumer engagement and increasing that. So anybody who's a patient or a patient caregiver might be interested in getting involved with finding out the best evidence for their specific disease. And I'll go through the slides from a call of the consumer engagement after I go through these, because I have that handy to give you an idea of the different things we talk about on these calls. There's also an opioid crisis response subcommittee. Because the opioid crisis is such a pressing issue in the US, coming up with evidence-based responses for it has been identified as a US priority, and we're identifying partner organizations who would like to work with the Cochrane to promote the best evidence for addressing the opioid crisis in the US. And lastly, we have a group that is working on a National Library of Medicine grant. So this might be of interest to the librarians. Lisa Schilling is leading it up, and it's having to do with a call for improved natural language processing and archiving. And it's a little beyond what I can get into here, but there will be a call for that grant. And I have more information on that coming up in another slide. Additionally, there is a network, well, There are 8 networks. The Cochrane Skin Group belongs to the musculoskeletal, orthopedic, skin, and sensory group, which is 8 groups in that. And they have web clinics. They just had a web clinic talking about split body trials. So if you're involved in a clinical trial where a person is involved as being their own control, where they'll use medicine on half of their body or half of their face and use a placebo on the other half, this is called a split body trial. And there are certain methodological issues that come into play when you're synthesizing evidence from a number of those. They happen to be quite common in dermatology, so this is an area of interest to us. But they had a web clinic on doing a meta-analysis of these types of trials, and the link to that is here in case anybody is interested. Okay, now I'll just go through some of the slides from the last consumer engagement work group call, which happened on November 7th, just as an example of what one of these subcommittee calls is about. So there was the agenda, people on the call were introduced. The focus and priorities of the group were discussed. There is some money for a challenge fund that's been put up by Cochrane to engage more consumers. And next steps for and the future of the meetings were there. So these were the people on the call. I represented us along with Patricia Hain, our deputy director. And there were people from 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, about 10 groups there. So it was well represented, but not unwieldy. And we discussed the previous call, and we also talked about engagement and the focus of the priorities. So a major concern of this call was to have a consumer voice at the upcoming Philadelphia meeting, and who that would be and who we could reach out to. And it was identified that we should probably reach out to as many consumer organizations as we could. Among those identified were the March of Dimes, Planned Parenthood, the Alzheimer's Association of America. So those were 3 of the ones that came to mind that this group is now reaching out to try to get to our national meeting in Philadelphia. They spoke about the challenge fund. So this is £2,500 British sterling, or about $3,200 currently, and they're going to have 4 awards of this amount. It's going to be, you have to be a geographic group of the Cochrane to apply for it. So we as a US Cochrane Center are a geographic group. So we are eligible to apply for this, along with all the other 21 groups in the US. Now, their priorities are to fund engagement of consumers from low and middle income countries. So because we're not a low or middle income country, we're not at the top of the list of who they're looking for applications for. But we're going to put in an application to engage consumers who have skin disease to contribute pictures of their skin disease to open access pictures to the Cochrane and to Wikipedia. And we're going to engage Cochrane consumers with skin disease around the world. So we think that even though we aren't a center in a middle or low income region, we have the opportunity to engage those consumers throughout the world and do a very important educational project here, because Wikipedia is the most accessed source of information for healthcare in the world. And they have thousands of chapters, or more than 1,000 chapters of skin disease, and not all of those chapters have a picture of the skin disease that they're interested in depicting. Also, a lot of the chapters in Cochrane's Skin, the 130 that we have, don't have skin pictures of the skin disease we're talking about. So we have an opportunity in Cochrane as well. And even when there is a picture, there often isn't a picture in skin of different colors. And different skin diseases can look very different in dark skin versus light skin. So we're hoping to engage 13 consumers a month for the 8-month period of the grant to contribute their photos, and we're hoping to compensate them for doing this with a small incentive of about $25, either in an Amazon gift card or a PayPal transaction of some kind. We haven't figured out the exact logistics of what we'll propose there. But obviously, getting a picture of yourself and posting it all involves resources, and it's hard to quantify how much that actually costs to do, but we think this is a fair, modest compensation for that. So if you know anybody with skin disease that might want to contribute a picture of themselves to the world to show what that skin disease looks like, we're probably going to want somebody who has had a physician or a healthcare provider say a diagnosis for the skin disease, and best would be a biopsy that also confirms the skin disease, so that we know that we're putting up a picture of what we think we're putting up a picture of. So the next steps for the consumer group were outlined, and there's one more call before the Philadelphia meeting to see who exactly that's been reached out to can go to that Philadelphia meeting. I also mentioned the National Library of Medicine grant. Here's the actual grant itself that the group is considering putting in an application for. And the next call to discuss that is on November 21st at 11 o'clock Eastern time. So if you're interested in participating in that phone call regarding natural language processing or archiving of evidence-based medicine and other issues, take a look at that grant and let me know if you want to participate in that call. So we're still at a very early process of figuring things out for our network, but things are coming into view. This is a picture of what the RAND scientists thought a home computer would look like from long ago. And they had a few things right here. They have the monitor. That's pretty close to what, they have a screen up there, and they have a mouse here of some kind of driving device. Everything got miniaturized. And the printer's pretty easy to spot here too. So we have some basic elements of our US network in place, but they might morph a little bit and become a little more streamlined. One thing that's clear is that we have a strong group of people who are very talented who all want to work together. So with that, I'll conclude this brief update on our activities in the US Cochrane network and our activities here with the US Cochrane. And I'm sorry that the colloquium was canceled and I don't have more to report on what was going to be the original content for this lecture. So do we have any questions or comments on anything I spoke about? I see we've been joined by a few more people out there. Hi, Dana.
Is that you?
Yeah.
Okay. Question out there.
Now we do have another lecture. I believe it's December 20th is our next one.
I think it's sooner than that.
Is it December 13th? Or is it Tanjing Lee talking about the Cochrane Handbook?
Yeah.
Okay. So there's been a new Cochrane Handbook that's been published on how to do systematic reviews, giving guidance on all aspects of that. And that will be here in the library. Tanjing Lee will be speaking. And is it December 13th? 18th. December 18th. So that's a Wednesday, December 18th. Same time, same place.
Well, I got a message from the Cochrane Network saying there was going to be a virtual meeting.
Yeah, so that's the virtual colloquium. So the colloquium that was canceled, the 4-day in-person meeting, that's the annual meeting of the Cochrane, that was canceled in Chile because of the riots, will be happening virtually. And it's going to be hard to know exactly how much of that meeting that's in person can be replaced. There is an annual meeting as well of all the members. That's one part of that meeting. And I think I got a notice as to that happening. So if you're a Cochrane collaboration member, they want you to attend the annual meeting, which is usually happens at the colloquium, but this year will be virtual, and give a vote on the different issues that they want the members to think about and address.
So that's like a business.
I think so, yeah. It has some informational content as well as to how well the Cochrane is doing financially. I think there's a financial report. There might be an approval of officers and other pressing issues. So I think that's probably the notice that you mentioned that you got. I got that today too, the annual general meeting.
Right.
Have you ever been to it in person?
No,
Yeah, here's your chance to attend, find out what it's like, and vote whatever time it is. I just don't know what time it's going to be our time.
And I had another question. You know, there's a lot of there's been a lot of controversy over, you know, that individual, I think from Norway, who got kicked out, and he has continued to kind of voice his opinion about the organization. And I'm on a listserv that kind of it's about evidence-based practice, but there's often a lot of discussion about Cochrane. I was wondering if you have any inside information or anything like that.
Yeah, how that person was dealt with was the predominant theme of last year's annual general meeting. So they spent a long time talking about that last year, and I think the Cochrane has moved on from that controversy, and a lot of it, I haven't heard much about it in the last 6 months. So I think that person has left the Cochrane and is not affiliated with the Cochrane, and sort of everybody's parted and is doing their own thing now. Is my bottom line on all of that from what I know. I haven't seen anything lately on Peter Gertchen and what he's up to. Okay, well, thank you so much for those great questions and for being here, and for the idea of starting some kind of national U.S. librarian
Actually, I had
call.
another question about the consumer group. Is there, I have a particular person in mind, if she wanted to become involved, is that something she could just contact somebody and
Yes, so I think we're planning on having maybe a U.S. consumer network, or certainly all of the individual groups, like the skin group has a consumer network interest in skin disease. So it depends what their focus might be, but I could certainly put them in touch with whatever group might best fit their consumer interests.
Thanks very much.
All right, and everybody's free to email me as well. My email is my name, robert.dellavalle@cuandshoots.edu. And if you can't handle that domain, the old one still works, ucdenver.edu. All right, thank you very much, everybody.
Thanks.
Okay, I did a stop share here.
Did you record it? Yeah.
Did we? Yeah. Gotta stop the recording too there, yeah. Or maybe we have to do that one.
Stop, yeah.